Hello everyone, my name is Juan Castillo and today I'll be discussing the roles the gut-liver axis has in alcoholic liver disease. First, I would like to start off by giving a brief overview of the gut-liver axis. The Journal of Hepatology defines the gut-liver axis as the bidirectional relationship between the gut and its microbiota and the liver resulting from the integration of signals generated by dietary, genetic, and environmental factors. This shows that there are multiple moving parts when examining the gut-liver axis. The way each of these components interact is through the portal vein. The portal vein enables the transport of gut-derived products such as bacterial byproducts and nutrients that have been extracted from digested food. The portal vein then sends them directly to the liver. The liver then processes these products and extracts the waste through the route of bile. The liver also secretes antibodies which are sent to the intestines. It is important to note that none of the interactions can occur properly unless the microbial communities are intact. Microbial communities are different microorganisms that live in the gut. The liver shapes intestinal microbial communities. If the microbial communities are disrupted, the gut flora will use its inflammatory conditions to try and regulate the gut environment. Overall, microbiome communities are critical in maintaining the homeostasis of the gut-liver axis. Moving on to alcoholic liver disease. Alcoholic liver disease, according to Nelms. The pathophysiology of alcoholic liver disease comprises a spectrum of three disorders: fatty liver, alcoholic hepatitis, and cirrhosis. Each play a contributing factor in alcoholic liver disease. Alcoholic liver disease originates from chronic alcohol abuse, which causes the liver to become inflamed, swollen, and covered in layers of fat. Alcoholic liver disease can also contribute to malnutrition, as someone without an alcohol dependency may choose alcohol in place of nutrient-dense meals, which can result in macro and/or micronutrient deficiencies. Alcoholic liver disease can cause permanent liver scarring and ultimately a loss of liver function. Alcoholic liver disease can also cause a loss in brain function due to the buildup of toxins in the bloodstream. As you see on the slide, I have provided a figure of what a healthy liver looks like and what an unhealthy liver looks like. As you can see, the unhealthy liver is yellow and covered in fat. Now we will examine how alcoholic liver disease affects the gut-liver axis and how alcohol disrupts it. Referring back to the Journal of Hepatology, alcohol disrupts the gut-liver axis at multiple interconnected levels, including the gut microbiome, the mucus barrier, and epithelial barrier. Alcoholic liver disease also disrupts the level of antimicrobial peptide production. This means it increases the microbial exposure, which promotes liver inflammation. With there being such a severe disturbance to the liver, it also affects the intestinal barrier. When the intestinal barrier is not functioning properly, it leads to translocation of live bacteria. This means that live bacteria travels into a person's liver, causing it to become infected. Bacterial infection ultimately affects the gut-liver function. According to the International Journal of Molecular Science, an increased intestinal permeability and bacterial translocation can enable microbial metabolites to reach the liver, which would impair the bile acid metabolism and promote gut dysmotility and systematic inflammation. In other words, the intestine is weakened and allows unwanted bacteria into the gut, then the gut will not be able to push the contents it has through properly, while also causing inflammation throughout the GI tract. With the communication between the gut and liver being disrupted, this affects the body's absorption of different vitamins and minerals. Ultimately, as previously stated, this creates malabsorption, which creates deficiencies in multiple macro and micronutrients. Some of these deficiencies that result from alcoholic liver disease are in thiamine, iron, folic acid, and riboflavin, just to name a few. Thiamine deficiencies can lead to Wernicke's-Korsakoff syndrome, which can be confused for typical intoxicated behavior, while iron deficiency can lead to fatigue and a low red blood cell count. A deficiency in folic acid can also lead to fatigue and mouth sores. Lastly, a deficiency in riboflavin can lead to skin disorders, edema of the mouth and throat, and degeneration of the liver and of the nervous system. Later, I will be discussing how these deficiencies can be treated and corrected. Next, I want to discuss how the gut-liver axis can aid in the treatment of alcoholic liver disease. In theory, once alcohol is eliminated from a person's diet, the permeability of the gut should return to normal. Once it returns to normal, I believe it would be a good time to restore some of the microbiome communities with new bacteria. I believe by giving a patient bacteria that is found in probiotics and foods such as almonds, peas, and Brussels sprouts will help return the overall health of the gut to a state where it functions normally. Yogurt may or may not be recommended due to the severity of a person's cirrhosis. A healthy gut also increases a person's chance of having a stronger immune system. According to an article published through the MDPI journal, anti-inflammatory bacteria taxa such as bifidobacteria provide important beneficial signals for the host immune system and may be responsible for the development of immune tolerance to food. In hindsight, with a properly functioning gut, the liver should begin to recover and function normally as well, depending on the damage done to it through cirrhosis. This will aid in the overall treatment of alcoholic liver disease by creating a healthy environment through the gut-liver axis. If the gut-liver axis is not treated correctly, it can result in an increase of bacterial toxins, which can lead to further inflammation and intestinal permeability. With normal functionality, the gut and liver should be able to absorb different vitamins and minerals adequately, reducing the effects of malabsorption. It is important to note that the roles of each patient's gut and liver axis may vary due to the severity and the progression of their conditions. Since treating a client's gut-liver axis is a bit of a challenge, I decided to showcase some documents that can be found through the Academy of Nutrition and Dietetics. The first document is used to provide meal planning tips to a client or patient. This document can be seen all the way to the left. These are just small tips to keep in mind if a patient is struggling to adjust their eating habits. Overall, it is crucial to provide some type of groundwork for a patient to build off of. The next document demonstrates some cooking and shopping tips to provide to a patient. This is beneficial because it teaches a patient what items to look for and encourages them to make better eating choices. By providing a patient with educational tips and a pre-made shopping list, they'll be able to buy the foods that will strengthen their gut-liver axis. This also creates better shopping and eating habits for the patient since it makes them more self-aware of what they are buying. The last document I have provided is a sample diet from someone suffering from cirrhosis, which is one of the disorders found in alcoholic liver disease. As shown in the meal plan, it provides a variety of foods for a potential client to eat. The foods such as pea pods and mushrooms will be essential in restoring the gut bacteria back to a healthy state. Again, this is a diet that can be modified and adjusted to fit a patient's circumstances and current conditions. Moving on to some of the dietary factors that will aid the gut-liver axis in the treatment of alcoholic liver disease. The main goal is to help return the gut-liver axis back into its homeostasis state. For this to happen, the gut and the liver need to function normally and sync with one another. The first dietary factor that is recommended is no alcohol consumption. This will aid the gut-liver axis in its recovery of the liver. When a person stops drinking, it reduces the swelling of the liver and in some cases reverses the damage done depending on how bad the damage is. The second dietary recommendation would be to provide a client with small meals with a variety of food from each food group. According to Mauricio Nelms, Catherine Sucker, and Karen Lacey, authors of the book Nutrition Therapy and Pathophysiology, patients with an alcoholic dependency should be encouraged to consume a meal plan adequate in energy and protein, high in carbohydrates, and moderate in fat intake with a regular meal schedule. The reason a person must start off with small meals is because they are better tolerated by a person's stomach since their stomach has shrunk in size. The stomach is smaller in size due to the alcoholics typically being malnourished due to their desire to drink rather than eat. As previously stated, People suffering from alcoholic liver disease would typically suffer from malabsorption causing multiple micro and macronutrient deficiencies. In the case where a person is not eating all their small meals or incorporating a variety of food, an oral supplement would be recommended. An oral supplement can make it easier for a patient with a reduced appetite to meet the nutritional needs for the day. With the patient eating right with their oral supplement, it is only a matter of time before they correct any micro and macronutrient deficiencies in their body. A person can take iron pills or a multivitamin to assist them in meeting their nutritional needs. By having a patient eating normally and assisting their diet with oral supplements, a patient's gut and liver function should slowly return back to normal. This means that there will be reduced inflammation in the liver. The microbiome communities, as mentioned in the beginning of the presentation, can also return back to normal, meaning that there will be a reduced risk of bacterial infections in the gut and the liver. Looking back at a few topics that we discussed today, I have highlighted some of the main points from today's presentation. It is important to remember that alcoholic liver disease is a combination of issues that affect the overall functionality of the gut-liver axis. Once the homeostasis state of the gut-liver axis is disrupted, expect to see bacterial infections, permanent liver damage, and malabsorption. To treat alcoholic liver disease, it is crucial for a person to cease their alcohol intake. This will hopefully prevent any further inflammation and liver damage. It is also important to note that any nutritional deficiencies can be treated with a proper diet, but it is important to remember to start the patient off with small meals throughout the day. If the nutritional deficiencies persist, then it would be time to recommend an oral supplement such as a multivitamin. Once everything is treated, the gut-liver axis should return to its normal functionality and its homeostasis state. Here are my peer-reviewed sources. Thank you all so much for taking some time to listen to my presentation. I hope I provided enough insightful information on the gut-liver axis.